sharing this side to come over. The ambulance, the president, and the board for supporting always. Hii board wamekuwa watu wa hospitali. They are always here. Tuko nao na stress pamoja hapa. And of course, the team, the health workers who are here for the good job they are doing. So, kusema ni asante. So I'll take this opportunity to just a small, Rasalba say something in behalf of the workers, the staff, just briefly, and then go to the MESO, the board, set by the chairman or anyone in the board who is here. Lastly, say something then at the end, say something also.
Thank you so much for giving me this opportunity. I want to recognize the presence of the CC, the chief officer, the chairperson, and the board members, and my fellow colleagues. That we are very grateful for you coming to the health facility. A lot has been discussed during our discussion as we went through the health facility. But what I want to emphasize is we are willing really to work and help the patient, because what is very important here is to improve the quality of care that we are giving to the patients or the community we are serving with health problems. One of the things is that I think it cuts across is the human resource. We have a problem with the human resource, whereby I can give an example that, like, at night we have only one health worker working. And if we have one health worker working throughout, that means the quality of care we are giving to this patient is compromised. Secondly, we need really your support when it comes to supplies. As long as we have the supplies, I think the rest of the things will be successful, and also the health-seeking behavior of the community around will also change, because when they come to the health facility, most of the things they will find at the health facility, and they will not go to the private health care. So mine is just to say thank you so much for coming, and thank you for listening. And I'm very sure, as you've given us the time frame, you are going to implement, and you have listened to us what we expect you to do to us as we journey towards the improvement of the health services that you are offering to the community.
Thank you.
Thank you so much for coming.
Thank you.
The chief officer, staff, and board members.
Yeah.
Mine is just to appreciate the support I get from the leadership of the ministry and from the board. We have so many challenges, but I think we have discussed going around, we are just going around, and hope that we'll be able to get the solution. More so, issue about water, which is a pressing issue in this facility. Then there's issue about the power for this facility. Because once you get the power on this other side, we're able to operationalize the things that we're not supposed to do. Wasili, he handed us the issue about the ambulance. That one, we started, when you gave us that ownership to be able to manage the ambulance, we tried with the little we had at the time, for the first 1 month or 2 months. But due to the financial constraints, the patient has been suffering to make sure that they fuel that ambulance to get taken to London. But thank God, the share is now open, and there are funds that we are promising that we will get in the course of the week. I think that will be able to help us to make sure that the pain the patient has been suffering to fuel the ambulance not be gone. Maybe there's something in the past. Yeah, because that one has been something that outcry in the public domain. Ambulance, they have to go using the protocols going to Lodwa, and that really it has been tainting our facility and the ministry and the public domain. So once we get the funds, with the board to be able to allocate enough resources for the ambulance so that the public cannot cry again. Issue all the small things that we're able to do. I think the funds that you are promising that we will get it, the board that we have, we'll be able to see that the theatre is supported very well, and the small things that are supposed to be procured using the board's authorization, we'll be able to make sure that we make actualize and things will go well. As we discuss the issue about human resource, Waziri and the Chief Officer, please mtukumbuke human resource, because these are centrally, the facility centrally placed. It's covering the greater Turkana South. That is Turkana East, Suguta, Aro, and the current Turkana South. So mtusaidie sana issue about the human resource. Tutashukuru sana once we get the additional human resource to be able to assist us to make sure that the service, the community goes out. Otherwise, thank you and welcome to this facility.
Turkana South, members of the particular board na staff ambao wako hapa, ningependa kuwasalimu kwa jina la Yesu. Bwana Yesu asifiwe. Basi mimi nitakuwa na mambo machache sana, kwa sababu wenzangu wamezungumza na tumetembea na tumeona changamoto na baraka ambayo pia Mungu ameweka ndani ya hii facility. So first and foremost, I would wish to appreciate and also to honor the privilege and the love ambayo sisi pamoja na Chiefs wamekuja ili waweze kututembelea hata katika hii Prom 2 visit, na ninaona Mungu ndiye anasababisha jambo hilo. So bwana CEC, waziri na Chiefs, karibuni sana. Asanteni kwa upendo huu ambao umetutembelea. Kuna changamoto ambazo at least tumejaribu kudiscuss, and actually katika kutembea kwetu na kuona facility, we were able to provide amicable solutions towards the challenges that we are facing as a facility. Na ninashukuru sana. One, ilikuwa ni mambo ya water, maji ambayo tumejionea, lakini nashukuru Mungu kwa sababu Chief Officer amejaribu kupiga simu, na tuna imani ya kwamba hayo maji yatapatikana kupitia hiyo solar charger controller ambayo ndio shida katika hiyo hospitali ambayo tulijengewa na Kenaha. Kwa hivyo bwana waziri na Chief Officer, hiyo ilikuwa shida kubwa ambayo ilitupata, and we were able to convene a stakeholders, emergency stakeholders meeting ambayo tuliita tarehe 11 Juni, na tulizungumza tukaona avenues yote, lakini naona hivi karibuni Mungu atatusaidia, maji yatapatikana na tutaendelea. Mambo ya stima, electrical power, hiyo haina shida, ni ile tu bili ambayo tunaweza kulipa kwa miezi karibu 2, lakini hiyo Mungu amefungua njia kupitia SHA revenue ambayo tunapata kidogo. Tutakubaliana, tutasikizana na ofisi ya Kenya Power, tutalipa tu kitu kidogo, na hiyo ingine tutajicommit na tutahakikisha hiyo stima inatokezea. Mambo ya chakula, bwana CEC na Chief Officer, asante sana. Sisi kama board tulikuwa tumekasirika sana kwa sababu hicho chakula mwenye alipatiwa hiyo kandarasi analeta chakula nusu, na actually mumejionea. Na I thank the county chief of medical services Dr. Lokichar kwa sababu amechukua hatua ya kwamba atapata huyo tender na mara moja hiyo jambo itakuwa rectified. Recommendation yangu kwa niaba ya board ni kwamba wakati hiyo contract yake itaisha na tu advertise tupate mtu mwingine, mimi ninaomba kwa moyo mkunjufu, let's get a local supplier. ambayo iko na capacity ya kuleta hiyo chakula haya hapa from within, na hiyo itatusaidia kuliko labda mtu wa mbali, na hiyo itatusaidia. Mambo ya pavement pia tumezungumza, mambo ya x-ray equipment. Hii ni notes yangu tu, nilikuwa nimeandika kama immediate needs ya hospitali. CEC, asante sana. Mungu akifungua njia hata kama ni kesho jioni, saidia sisi kabisa hiyo x-ray equipment ikuje ili tusaidie. Ndio sasa hiyo hospitali iendelee kabisa kuwa level 4. Unajua bwana chief officer, naelewa hii hospitali kulingana na vile mnaona haijafika hiyo level 4, tunasema level 4. Hii ni level 3B. Na kwa sababu ya aina hiyo vitu vingine. So, saidia hiyo x-ray equipment machine iingie haraka na itatusaidia. Mambo ya ICU stroke HDU facility hiyo nitapambana na MCA wa eneo hili, na tutahakikisha kwamba kabisa hiyo imejengwa ndio to meet threshold ya kuwa level 4. Bwana Yesu asifiwe. Hiyo ndio jambo ambalo ningependa kusema. Otherwise sisi tunafanya kazi pamoja tukishirikiana na medicine pamoja na MOH na pamoja na staff, na tutahakikisha kwamba hospitali hii itaenda mahali ambapo inahitajika. Mambo ya madawa hapa, nashukuru kwa sababu unasema utaanza inspection ili ya makliniki na makemisi iko hapa. Kama ile dawa ile dawa wanauza ni yao kulingana na delivery ama ni ile inatoka hapa, na mimi I will be in full support. Akapatikana labda kama kuna dawa imetoka hapa imetoka hapa imeingia kwa makemist na kwa makliniki, hakuna msamaha. Yule ambaye amehusika lazima afanye nini? Akabidhiane na sheria. Na mimi nataka ku promise ya kwamba tutashirikiana na kuhakikisha hizi dawa ambazo zinaletwa hapa zinaenda kwa watu na hazitoki nje hapa kwa mahali pengine. Zile inatoka nje tu ni ile anapewa patient ili aende afanye nini? Aende atumie. Otherwise hayo tu ndio ningesema bwana MH, na asanteni na Mungu awabariki. Maybe tu mwisho kabisa, board members ambao wako hapo mnaweza kusimama. Board members ambao wako hapa mnaweza kusimama tu. Hiyo ndio nilikuwa nataka kumalizia. Board members, board members hawa tu ndio walikuwa karibu, wale wengine kwa sababu member ex officio is also a team member. Bas hawa CEC na chief officer hawa ndio board members ambao ufaulu kuja. Kuna wengine karibu 2, 3, 4, lakini hawa ndio tunashirikiana wao. Asante na Mungu awabariki.
Everyone is here. That is it. Kwanza ni kuwashukuru for the patience. Really, I know sahi tumbo linalia. I will summarize. The Turkana South population of around 94,000, and this is a significant population considering the centrality where we are really central, and that means our needs are beyond this account because of the nature of where we are. By this facility being here, to serve Turkana East, mpaka Suguta, to serve Arok sub-county. So what I foresee hapa mbele is there will be more needs and the demands from this ahead. One service that maybe wenzangu wamesahau kusema ni maneno ya dental department. We have tuko na vet, we have the dental clinic here, but we have a staff who is a USC staff. Now kama sahi wako strike, that means those services, and I think I remember Chief CC promised that we will get a dentist here. The other thing is I also foresee the disruption of services, especially the CMOC services. So we need an extra MO, at least to support here and Khartoum, so that we don't have at one point services getting disrupted. That is anesthetist and EMO. Because the soldier will work for like 6 weeks and another to end up rest for 3 weeks, for example. That time, we need someone to step in so that we don't have the disruption of services. Because of where we are going, the needs for specialities are needed. For example, pediatrician, for example, because of the newborn unit, the pediatric department. Those are the needs that we have a gynecologist here, at least the CO, RH, clinician. But there will be these other specialist needs that is needed. That is for this facility. But I'm happy that the health financing is being getting sorted, which is usually a driver of many of the other things. Of course, the issue of the registration of nets. Nets of but I think we make it a priority now. Because the last time we talked to the other grade that it does that, so that we're able to access the drugs through nets. So otherwise, that is that for here. We have for the sub-county, we have a total of 18 facilities. 16 are functional and 2 are non-functional. That is Chebilet and Kakale. Because of issues of staffing, others are not there. It was vandalized. The other one was vandalized. That is Kakale. But we also have, even these operational facilities, there are those ones that are using just the PS as staffs. That means the urgent need for staff like 4. We have an area like Sopel, don't have a nurse. The Bolsonaro don't have a nurse. Lomelefu doesn't have a nurse. Ramaki Group doesn't have a nurse. Chabilet and Kakale. So those one need at least one nurse. But the other facility also have only one nurse, meaning they don't have time to go to rest. So that's a serious gap. We need at least for these dispensaries, at least 2 nurses, so that we can guarantee continuity of service. Most of the facilities also want to receive DAO, but that challenge of antibiotics, especially for children, is what also hear from the facilities down there. So we keep in touch with the Director Kare so that we get the updates on what particular drugs we lack, so that we always have something. Because Sarasana area, the bites are many, bites and issues of Kalaza. We thank God that I talked to the World Vision team. They were able to support the training for the whole facilities in Turana South for Kalaza. So we train all the staff on Kalaza. The next phase is we want to build capacity for CFPs and CHAS, so that now we get the community referral and the demand from the community, and the facility are able to test, and then they are referred to Lokichar for treatment. So that's the plan we have for Kalaza as a sub-county. That is that on the issues Kalaza. But there are also other training gaps. For example, INCI, ITAT, BMOC, because these are basic trainings to build capacity of the staff so that they're able to respond adequately. Because most of these staff also are young staff who need the capacity to be built. Those are the training needs of the sub-county. So far, the 11 facilities out of the 18 facilities are doing claims of SHA. And 4 facilities have already started receiving the money. That is in Kabul. We have Lokichar, we have Lokichar and RCA. So we expect the other facilities also, the ones who are claiming, the 11 of them, to all receive their money. And so far the good work is doing, most of these facilities now have started utilizing their own money, and so they're able to solve their own issues. And even these issues of referral, they're able to support the referral on their own. For those facilities, they're able to do the claims, and they're able to receive their money. So otherwise, thank you very much. Nitaachia hapo ni hadithi ya dunia.
our chief officer, a director, health workers, and a board. I want to make my introduction because of Daktari and him. We've never met, but these other guys are not known. I've interacted with the chief when he was the chief officer for livestock. My name is Kolai Simon. I'm the sub-county administrator for Turkana South. Our CC and the chief officer, karibuni sana Turkana South. Karibuni Lokichar sub-county hospital. Mmejionea vile mambo iko mpaka hata mmefurahia sana. And I like the fact that you want actually to bring back the patient who belong to Turkana South back to this hospital. We will receive them. That is very good, and they are ready. You are ready to receive them?
I am ready.
Yeah. I'm one sub-county administrator who coordinate well with these officers. I coordinate with them. I coordinate with the board. I coordinate with the MOH. Very seriously. I even visit this sometimes when I just visit the hospital at night sometimes. At least to find out whether those who are on duty are there or not. But not fault finding, you know. Just to find out actually, is it running even at night? So we are working well, we are coordinating well. I think when I CEC and the chief officer, you've just had the problem affecting this hospital, and I also want to repeat. I classified into three: number one, water; number two, electricity; number three, staff. These are the major problem affecting this hospital, and because we have you, we are optimistic that we are going to, some of this problem will be solved very soon. Because I know you guys, that you are going to solve some of this problem. The issue of water, as mentioned repeatedly, it has been a problem that's affecting this hospital for quite long. But recently, as he mentioned, we had a meeting, and we said, in fact, I personally say, we need to take a different direction for this issue, because we cannot solve locally. It's an issue that we cannot solve locally. So we decided to say we have to follow legal procedure, and that is why very soon maybe you will get that issue, and we will follow a document. We have a document, and I saw that document. It was signed. It was a document on handing over, which was signed by Dr. Lokichar, and Dr. Lokichar is here now. It was signed by Sub-County Administrator Fleming.
Alexander Fleming Loskiria.
I saw the document, and now that Daktari, you are back, you will be in a better position to pursue this thing, and even to witness, because you signed it. Your signature is there. I saw it. So these are the things. I think it's simple. It is administrative, like staff. Tunaomba sana tupatie officers, because this hospital is actually covering, is actually serving Aro, Sukuta, and Turkana East, and even Turkana South. So if you are able to give us enough staff, then we'll appreciate. Another thing, I've been actually doing a campaign throughout. Anytime even I go to Aro, and I think I've been communicating to you, CEC, it's about the theater. I've talked about it several times, even yesterday. You can confirm. And I've been doing it like a campaign, because I want people to understand that we have an operational theater in Turkana South. Some people, this theater will reduce the cost of our people moving from here to Loda or even to Kitale. Like wakijua tu watakuwa wanakuja. So I think that is better, and tutafurahia sana, and I like the way you always, when you come, you call all of us so that we work together. Nataka kumalizia kwa kusema I worked with my deputy. Nataka tu simame salamiane, alafu ni karibishe director. Karibu sana deputy wangu.
board ya hospitali yetu Lokichar sub-county, madaktari, kwa wale ambao kwa wanajua ni nafasi yetu nijua. Mimi naitwa Peter C. Mimi second command kutoka kwa deputy sub-county administrator kutoka na south. Hata mimi niko na furaha because sasa vile chairperson amesema these ex officials. Unajua second commander isipokuwa second commander lazima at least mambo yaendelee kwa niaba His Excellency the Governor. So mama, hata mimi niko na furaha hasa kuja kwa ground kabisa. Lakini sasa kwa waziri wengine, I'm sorry to say, sisi public service wako waziri wengine wamekuja kwa public service wajapatana hata na administration, wamekuwa transferred. Hata wengine hawajui nani amekuwa kwa changes. Hiyo issues sisi tumewahi shuhudia kwa ministry. But sisi I'm happy nyinyi mmekuja kwa ground kabisa. Msikize kwa ground vile mtu anafanya.
Ground inasema nini?
At least gaps ile above naona challenges, success ya above vile iko kwa hospitali yetu na pia kupeana guidance. I'm happy vile niambia pharmacist watu pharmacist. Yaani mambo yenu kuplace nini procurement yenu mapema. Isio ya kuwa at least taka tukuje tuulisane. So thank you so much. Na pia kitu cha mwisho ni kuwa the administration ndio na coordinate the 10 ministries. Governor is point agenda number 4 health services consultation. Na pia kwa sisi tuko na hiyo nafasi ya mabarazas. So tukiwa kwa hiyo mabarazas, hii mambo si pia inaongelewa. Inagusa ministries, hasa hospitali nini watu wa siasa, sisi tuna encounter. Tunasema sio hivyo vile sub-county anasema anakuja hapa kuconfirm. Ili at least awe na jambo fulani ya kueleza. Kwa yako hivyo vile mnasema sio hivyo, it's like this. So thank you so much.
Thank you very much. It's now my pleasure.
Sub-county hospital, board members, our staff, and then our colleagues present here. I'll be very brief. Waziri, I would like just to begin by appreciating you and our county chief officer for this visit, and also granting me the opportunity to come and be part and parcel of this supervision team. Secondly, I would like to also really most sincerely thank the staff of this hospital, the sub-county administrator, and the board, led by the chairman, for the proactive, sort of like attitude and striving, inspiring for excellence, because this is one of our very, very model sub-county hospitals. It is not something that I just say for the sake of it. Lokichar sub-county hospital is a model, and I think other sub-counties, other medicines would come and benchmark, with you, with regards to even how you work together as a team. It's quite laudable, and we want to remark you for that wonderful teamwork. We know Lokichar sub-county hospital is very strategically placed, as you've said, because of the populations that it serves. It is very centrally placed, and being just even along the highway, it is the first stop for Turkana. Anybody who wants to go to LCRH, for example, Lodwa, or even Kitale, akipata facilities hii iko na kila kitu, atapanda gari kweli? No, hawezi. Because what takes them to those places is just the mere lack of services here. So, and I know the health leadership of our ministry, led by our CC and our chief officer who are present here, have the broader plan for the sub-counties to decentralize services from the headquarters, which is the County Referral Hospital, to the sub-counties, so that you can be able to be, it's the spirit of devolution, so that you can be independent, and self-sustaining yourselves. That is what we are trying to do, even with these visits, to be able to understand what don't you have, so that we bring them closer to you. Issues of human resource, issues of equipment, you understand? Yeah. Whatever you need, supplies, that is all in the broader plan for the ministry, to be able to serve you, so that our patients can get quality care and of course better outcomes. Waziri, on the issue of the supplies, I would like to mention here that as you are aware, we have a very structured way. Turkana County is one of those very, very well-performing counties, even in comparison to the rest of the country, other counties. Why? We have a very structured way of determining requirements for the county. We use data-driven decision making. The data that you collect here, whether it's in OPD, whether it's in inpatient, now you started, or theater. Whatever you're going to collect, you report it. That is the data we use to make orders for you. So I would like to encourage that you report as it should be. All the registers that are here, let them be filled on a daily basis. Pharmacy, records zake zikuwe intact. That is the data we're going to pull from the system, ile inaitwa Kenya Health Information Systems, so that we allocate you money based on the data. Because the data will show the number of patients that you're doing what? You're taking care of or you're serving. So data driven, we do that every quarter. We do what we call a demand forecasting and codification. Lokichar sub-county, I can check my records. The last time we bought, Waziri flagged the drugs worth 120 million here. I don't know what you got. I can check. I don't want to lie. But normally it gets the highest allocation in Turkana South, because of the number of services it offers at the patients. So after here, using your flag tena, use year 60, I am telling you, it goes the highest allocation. But we want to be giving you more. We want to be giving you more. So KEMSA supplies us, but also sometimes kuna vitu KEMSA haina nini? Haina. And that is why we are insisting here. I've actually tasked the Medso to submit the forms for meds today, so that you can process your account with meds. The things that they have said they don't have, like for theater drugs and all the others, zitapatikana wapi? Meds. The moment we open an account, we prepare those orders. If we don't have any payment issues with meds, so wataleta down. Na wanaleta hapa direct. So I would like to ask the MOH and the Medso to really work on that issue. Secondly, SHA. We are using SHA to increase availability and access to medicines. So please, register as many patients as possible. The more money you get, hata saa zile labda ministry ama government imefinyika kidogo, sinyi mtakuwa na pesa yenu hapa. And all you just do is to buy things kama sasa hiyo tumesema benzoyl temalcho. Mulipata outbreak ya scabies, si ndio? So mnanunua tu kidogo na hiyo pesa yenu. Alafu inasaidia nini? Inasaidia wagonjwa. So SHA is also the other thing which you can use to increase access. Specific issues which I want to mention is the issue of safety and security of health products is something that now we are taking very seriously. Our Honorable CC has mentioned that, and I don't want to repeat what he said. I think he was very, very clear. True or false? He was very, very clear. We were going around the county, and pharmacy, ati ndio mahali tu anybody anaweza ingia, alafu kila mtu ako na kifunguo. How does that even happen? It's a restricted place. Only authorized access. Only authorized. Ujue ni watu wawili wako na kifunguo na nia manani. So that if anything happens, wao ni watu sisi tutafanya nini? Tutauliza. Hii dawa mnasema ilipotea na ilikuwa hapa jana. Ilienda wapi? Nani alikuwa usiku? Lakini sasa kuna facilities. Unauliza nani ambaye wako pharmacy? Watu wanaanza kuangaliana. As in it's everybody and anybody. That is I think for us the biggest risk that we have in our facilities. There is no ownership, and accountability. So that's something that we want to do. Accountability for HPTs. Wapi Simon? Simon Akwapa. It is one of the model facilities Waziri. I will tell you. Bin cards here, one update. As soon as they remove something, physical inventory, they do it. Reports, wanafanya. The only thing I want to improve is wakati dawa kama sasa imeisha, msikae mngoje. Someone has to write somewhere, alafu apige simu. Ambie tu Andrew atascalate kwa sub-county mwe, ama sub-county pharmacist, itatufikia. The moment ikitufikia, our bosses are here. Kama hatuna mahali, mimi napelekea tu chief. Na mimi najua chief officer nikimpelekea atanitask aniambie why don't we do this and that. Are we together? So that communication is very, very important because that's how we know. Because unajua hatuna macho hapa kuangalia ati sijui Lokichar sub-county haona moxidity. Sasa tutajuaje? The next thing tunasikia tu kwa gazeti ama sijui kuna mtu ameongea kwa baraza. It's so bad. Yeah. So you're our eyes. So please do that. For the things Waziri that they said they've needed, I have taken the list. I've also requested them to make specific orders on Excel, and then we'll discuss with the CRF. Whatever is not there, once they open the account with meds, we order to meds, alafu tutaangalia mambo ya budgets na all the rest. Because najua pia SHA yao ni kama haijaanza vizuri. Hivyo tu. And then the equipments we will procure as per budget, whatever we get. Like the digital x-ray, the biochemistry analyzer, and the hematology analyzer, kuna hiyo QBC machine yenye umesema, alafu hiyo HB. Otherwise, nataka tu kuchukua nafasi kuwashukuru sana kwa kazi nzuri yenye mnafanya. Thank you so much. Thank you. Sorry, Chief.
Now, welcome our able chief in 5 diseases.
Thank you.
Thank you very much. Sub-county administrator is one of the very working officers in this government. The CEC for Health Services and Sanitation, Dr. Joseph Epem. The Director for Health Products and Technologies in the Ministry of Health, Mr. Paul Karereng. Our Sub-County Administrator, alongside the Deputy Sub-County Administrator. The Board Chair, who is none other than Bishop Emery, and the entire board of this hospital. The Sub-County Medical Officer of Health, Mr. John Nasike. The Medical Superintendent in charge of this facility, Mr. Andrew Lokong. The entire leadership and participation of the Lokichar Sub-County Hospital. Good afternoon. Good afternoon again. The Sub-County Administrator told you that I am just fresh from livestock. In livestock, mgonjwa akikusumbua kidogo, unachinja na unakula. Apparently now in medicine, mgonjwa akikusumbua kidogo, unamuadmit, unamtafutia parenteral medication. So I have to do again some paradigm shift and realignment. Although this is my mother ministry, and this is the ministry that I have trained in my professional trajectory. But it gives me great pleasure because when I was joining in, Bishop, when I was joining in the ministry like some weeks ago, my colleagues whom I left behind, waliniambia huyu daktari ameanza kunuka mbuzi. So we need to fumigate him kidogo atoe harufu ya mbuzi ndio tumruhusu akuja angalia wagonjwa. Anuke dawa. So I believe that the board members wanaona saa hizi nanuka dawa. Hakuna maarufu ya mbuzi, especially sub-county administrator mwenye tulikuwa tunagawa mbuzi. So it gives me great pleasure actually to have been invited by the CEC to come and join this supervision. Yesterday we were in a facility called Kakuma Sub-County Hospital. The day before that we were in a facility called Lorugum. The day before that we were in LCRH and Kanam. So basically the whole of this week we have been on the road and on the move to ensure that the facilities within Turkana, they are okay. But I must admit, and this is just for your ears only, of those facilities that I've mentioned, Lokichar Sub-County Hospital has impressed me the most. Honestly, without fear of favor or without fear of contradiction. In terms of cleanliness, you are way up there. In terms of infrastructure development, you are way up there. In terms of patient dignity, mahali unaona patient wamewekewa linen chini, Lokichar Sub-County. In terms of hata niliona the cleanliness of the kitchen. Ukitaka kujua hata kwa hoteli, hebu ingia angalia mahali chakula inaandaliwa. It is usually a bit pathetic. But Lokichar walifungua mpaka jiko yao. The only thing iliwaleta chini ni hakukuwa na maji. So wakawa watu wanapikia huko nje. Hiyo tu. But otherwise by and large it was very good. And even the mortuary of all the places, it was very spacious and it was very good. So from the bottom of my heart, on behalf of the Department of Medical Services, I want to sincerely thank you, the Sub-County MOH, MedSup, and the staff of Lokichar Sub-County Hospital for the good job well done. For the good job well done. Equally on the same footing, kuna kuanga na hii migogoro ndogo ndogo wakati watu wanaanza kufanya kazi pamoja. The board and the management of the hospital and the management of the sub-county, kuna kuanga tu na kashetani fulani ambayo huwa inawatembelea. Huyu anasema hapana, hii ni yangu. Huyu hapana, wewe unaingilia. Lakini sijui kama inafichwa chini, but what I have seen in Lokichar, there seems to be that commingling and there seems to be that, in English is called camaraderie, that seems to exist freely. Sijui ni roho ya Mungu ama sijui ni nini, but kuna hiyo utangamano that exists that actually I find very, very good. And for a community to move forward, people must come together. Baladung tuka na kulung kuno tarte gumotepe. Anirmo toro ya di ulotonga krongari. Koringote nini. So naomba ake shetani asiwatembele. Because if you continue like that, mimi naona hata level 5 itafika tu. Hii maneno ya level 3 haitakuwa mwisho. Because your infrastructure wise, you're actually way ahead. I'm not supposed to talk a lot, but I'm just supposed to hit the nail on the head. Maneno ya patient food that the chairman talked about. I have my own job description and my own deadlines. By Monday, simulisikia Monday, I'm supposed to ensure that the supplier ameleta ile chakula yenye baada hajaleta by Monday. Sio ilikuwa ni agizo yangu. Yeah. Number 2, Kalaza patients. Tumekubali wale wa Lokichar wafanywe nini? Warudishwe. Kwa sababu there is space, chakula iko, madaktari wako, kila kitu iko. Mbona upeleke mtu kwa jirani ati achungwe na jirani while actually you are in a capacity to do that? Kwa sababu hiyo ndio how you can claim that money from SHA actually for that inpatient, so that you can boost you can boost your revenue base. I've also been instructed that Kalemngoro has actually to be an Kalaza testing facility, because tuliona kwa ward au kuna mgonjwa alikuwa ametoka hiyo area. So if Kalemngoro becomes a testing ground for Kalaza, alafu through this director tuweke medicine hapo, si unajua itazuia pia itadecongest Lokichar sub county. Maneno ya maji, I think he talked about it. We decided to approach it in 2 prongs. First prong is to go the ministry way. I have spoken to Honorable Akwalata. I know the CEC is going also to hamify what I've mentioned. Akwalata is telling me that in spite the fact that he does not have money, but the development partners who are assisting him on water development in Turkana South is going to approach them and ensure that they attack the issue of water here as a question of emergency. Equally, the Kenya resident engineer, Engineer Vincent Oduor Chengo, I have talked to him on twin issues, the issue of mortuary and the issue of water. And he has told me to give him some time, and he's going to ensure that he has actually spoken with that contractor, and then he gives me a feedback on what the contractor said, in spite of the fact that he had already handed over this facility to government. The third issue, or the fourth issue that I'm supposed to ramify is that I am supposed, within a period of 1 week, kutoa a mobile X-ray from Kanamkemer Sub-County Hospital mpaka hapa. So the direction is already clear, and my job description is already clear on that one. There are a few issues that are touching a whole broad range of human resource. Si tumesikia radiographer hakuna, clinical officer pediatrics tawe hakuna, nurses ndio hii tumeambiwa ni 14, so wangependa wengine waongezewe, etc. etc. Human resource, everything. In fact, the sub-county administrator summarized it and said that the problems of this hospital, there are 3 prongs: electricity, the water, and human resource. On that issue of human resource, I'm glad enough to report that the county had recruited about 108 staff for all the health facilities in Turkana. Now, usually when it comes, we have to do posting ourselves in our office. And I want to say without fear of contradiction that Lokichar sub-county hospital, si itapata share yake. Si Yamro nakitalio kwa si atatoka area hii. So, hiyo ni kwa Yamro nakitalio. So, Dr. Rosalba, you will be interpreting it to the Daktari. When I say Yamro nakitalio, what I mean. So I will handle that. Colleagues, you've heard about the issue of drugs. Drugs, you are not badly off. But intravenous drugs that Dr. Rosalba talked about, anesthetic medications that Dr. talked about, all these, the reason why patients go to the hospitals ni kutafuta dawa. Na ukienda hospitali upate hakuna dawa. Kwa nini basi ulikuja hospitali? Si uende basi kwa kanisa uombewe na bishop upone, Mungu akuponye uende. So it is our job then, who are here, to ensure that our facilities have drugs. Madawa ziko. Shida ni hii iko hapa, hii iko hapa, hiyo iko hapa. Na kazi ya uongozi is to tie together those loose ends, ndio mgonjwa asijue. And I have a very sharp director of health products and technologies. I've already instructed him that this facility must open an account with meds, so that zile madawa ambaye hazipatikani KEMSA zichukuliwe directly from where? Meds, directly, without fear of contradiction. Zile madawa zinapatikana LCRH za theater, we should be able to get them, alafu mimi nitawarudishia. Mimi naamini wakati mimi sina chumvi hapa nitaomba kwa jirani. Mungu akinifungulia nitamrudishia chumvi yake. Hata mbuzi njaa naye tinya akorong tungaluka. Msi aluli alipakinia ita tara tungaluka. Na ngolikini abwithia ngakuma ka ketinge kwenge. Si aluli akoka na rumo kukuringote. Dr. Rosalba, are you doing interpretation? So we will quickly be able to borrow one or two things from wherever sources and using the resources that we have, so that then we can be able to assist you. Kwa maneno ya financial resources, hiyo sitarudia. Sisi tutaenda msitu ya serikali, tutatafuta chenye tutatafuta. Leo ni tarehe 26. We have 4 days before financial year serikali ishe. The budget is here, the supplementary one is here to be uploaded. Immediately it gets uploaded. Kuna hiyo instructions that have been given. Kuna pesa about 45 million ilikuwa mahali. So nimeambiwa I should be able to dismantle, dislodge, disenfranchise and disintegrate some of that money. In Turkana it's called Topok. Diska, ambia Rosalba endelee. Huyu tu ameona nikisema topwenyi. So on the issue of drugs, we will do our best. Chenye tu ni muhimu, msione watu walodwa ni kama wale watu wa Lokichar, sisi watu, we are all one. When there is a problem, just reach out at a phone. Do not hesitate, because we are always ready. That's why hatujapumzika tangu Monday. We've been all over just to ensure that you guys receive the support that is required. So that money will be there. Next financial year, kuna pesa imewekwa kwa sub-county hospitals and MOHs. I'll ensure that that money has hit your account. And when it hits your account, mtumie basi vizuri, ndio mjipange nayo, msaidie nayo watu. Maneno ya private clinics, I think it's as clear as daylight. Mesikia, we'll form a committee, and there is an advice that was provided by, I think, Diska, if I'm not wrong, that we should do this thing concurrently in all the 11 sub-counties, so that we rid those private health facilities that are pilfering medical supplies from our public health facilities, that are mismanaging our patients, because they have employed quacks or because they are not adhering to the medical standards that have been set by the Kenya Medical Practitioners and Dentists Council. We are putting them on notice that their days are literally numbered. And when we cut them, it's not just closing the clinic. You will go for prosecution. Uende uonje ile unga ingine, sio ile kitchen ilikuwa clean hapa, ile ingine ya huko. And it's as dangerous as that. So if you exist and you are opening up a facility, it is high time regularize your thing and then become properly registered to offer those services. And if not, just kindly stop it with immediate effect. Otherwise, from my desk, I think that is what I have learned. That is the feedback I will give you. I want you to continue with that spirit of teamwork, and you be able to build this facility to higher heights of glory. Without much ado, it is now my singular duty and honor to welcome the CCM in charge of health services and sanitation, Turkana County, Dr.
Thank you, Chief. Our County Chief Officer in charge of medical services, Dr. Gilchrist. Our Director, HPTs, Sub-County Admin, and his Deputy, Board Chair, and the entire board of Lokichar, Sub-County Hospital, the Sub-County MOH, the Medical Superintendent, and the entire team. Good afternoon. Good afternoon. Bwana Yesu asifiwe. Amen. I think mine is will be very short, because what we were doing when we were walking around, we were doing our meeting. when we were walking around. And most of the things that we discuss is what the chief officer has just, is the one who implements. As the CEC, I just give policy directions, and then the chief officer implements. So that's why when a good CEC meets with a hardworking chief officer, things will move very fast. Because that is the only thing that usually brings down departments. Yeah, when pulling in different directions. So already I am happy that we have achieved the objective of today's visit. I only want to add 2 things so that we don't spend a lot of time here. And I will start with the issue of water. I want to say that in the spirit of achieving our objectives very fast, I think we need to give these people the same instruction that we gave Kakuma yesterday on this issue of water. That they need to look for a contractor who is able to supply this thing on Monday. Because you are getting money. Serious. The power of the chief officer, once he gives you that, like you can be a funny, it is as well as money, right? That is the promise. The chief officer is the one who signs, is the accounting officer. So even if it means us giving you a yellow PO or something, so that we get that issue of water issue by next week. Hata wale wengine wakikuja watusaidie, it can be a spare. These things break more. Yeah? So, what we are saying, Medsu, a chairman, kama mnaweza kutafutia mtu mwenye anaweza supply it. Yeah? Awasiliane na chief. Alete hiyo kitu. Apatiwe PO na chief. Kwa sababu si peseni kwa hapo mbele. 90,000 itatufanya tukae mwezi mmoja bila maji. Na sisi ni serikali. We should not do that. We are a government. And we need to move. It should only be things that are more than 1 million or 2 million. Ndio itatustop. Lakini anything lower than that. Hii ni pesa hata tunaweza changa. Unaelewa? Sisi kama management. So, tafadhali, this should not stop us from having water. So that is just one of the things that I wanted to tell the chief. The second issue is on the functionality of the hostel. This is service delivery. This is one of the agenda that we discussed in Kakuma. Service delivery is a very key issue. You cannot have buildings which are, some places are empty, they are not working. So, like the mortuary, we want this mortuary to be operational in the next 2 weeks. 2 weeks. So, how do we do that? The chief officer, I will follow up with the person of Kenya. Ikishindikana, we come up with the plan B. It's just like that. Because sasa tangu Kenya wa hand over his facility imekuwa long. It is a month plus. It is 2 months. And yet wanasema wame hand over it is complete. So there is something amiss. So we want the mortuary to operate within 2 weeks. Subject to what the chief officer will get, from the other guys. Ikishindikana hata sisi wenyewe tunaweza jitengenezea. So that it operates. So every place should be busy. Yeah? It's also a form of you getting your revenue. Then that is now the innovativeness that we were talking yesterday in Kakuma. Remember this facility and Lokori and Kapedo. And the Azikwa registered. Nakumbuka?
What was registered? Yeah, Kapedo.
Tulikuwa Kapedo na hii pekee. So, na wale watu wa board wakatuambia wanataka allowance. Ni wa register. So, ikabidi tu boroboro pesa, si wapi, yani tuhakikishe tu the facility. And that was a lot of money. It was 300,000. Imagine that 300,000 was not anywhere in the budget. But we got it. Sasa 90,000 itatushinda shule. So I want you to be innovative even in your own, when you're here. there are things that are very urgent for you, and they might actually help you if you become innovative. Ya tatu ni issue ya signatories. Yeah, that is an issue that I found also in Kakuma. Now I know it is also affecting this facility. So at the any minutes, a change of signatories, military chief officer by Monday. So that you regularize your account. The new chairperson of the board. I know the act says that mandatory signatories are the administrator and the magistrate. But that does not prevent the chairman from becoming a member, a signatory, so that he can be getting the reports. We want transparency now, yeah, in all our facilities. I think maybe in the next 2 weeks we will gazette the ones for health centers. But for dispensaries, we tuliambia tu wajichagulie, alafu tutumie list. But we are only gazetting up to health centers. That is just something we decided internally. So we want in the next 2 weeks to gazette hizo za health centers pia. By the time mpate hiyo pesa zingine, kwa sababu it was already an audit query that they have overstayed and we have not gazetted it, so we need to give them money. Ya mwisho ni kuwashukuru kwa ile kazi mnafanya kama sub-county hospital, tuendelee namna hiyo. Na mimi najua hiyo hospitali inafaa kuwa busy kama LCRH. Lazima naikana show hiyo. Hata Kakuma. Lakini zote hizo hospitali mbili ziko na the same challenges. Operationalize and the issue of service delivery. So nyinyi mko tu proactive. You will start collecting here a lot of money in a day. LCRH is now collecting, I think, 100, 150. That's what they told us. 150,000 kwa siku moja. Na wao wanapeleka 1,000 kwa siku. So, but tutakusaidia kwa hii mambo ya hii committee yenye itaenda around kufanya spot check. So we are going to close many. I know we are going to close many clinics. Because I know they have been there. Walikuwa nafikiri sisi tunalala kwa kazi. Tulikuwa tunaangalia tu kwanza. Tukiwapatia nafasi ya kuingia live. Lakini now from in the next 2 weeks tutaenda kwa clinics zote. Na haitakuwa ati tunapita tu ati wewe ufungue kesho. We are going to put people who will ensure if you have closed, you close forever. Or you comply with the law. Those are the only two options. So wale wanafikiri ati watafunga ati watu wakipita waendelee kuoperate. They are in for a road show. Kwa sababu tuta-incorporate pia administrations, sub-county administrations, village admins, all those people. Kwa sababu all these reports come together. This is one government. Mimi napenda tu washukuru na niwapatie salamu ya His Excellency the Governor. Na anajua tumekuja huku leo na ile issue kabisa kubwa ni mambo ya maji. Mambo ya maji tusuluhishe. Hii ni short term measure. Hata tukinunua hii kitu. The long term measure ni kuhakikisha ile maji yenu. Ile iko karibu na laga. Ikuje juu ndio maji mingi. Hii nasikia hii law iko na hiyo law hii. Kwa hivyo mimi ndamalizia hapo na niseme Mungu awabariki. Asanteni sana.
Director for the time. So we have one request. We lost a staff who was a partner staff, and the Health Workers Forum raised a request to the ministry that we support. Maybe out of the share government, if any support towards that staff, Rose.